I'm Bianca Avery. This is video checkoff assessment number 2. We're going to start with hand hygiene, and then we're going to go introduce ourselves to the patient and obtain permission and identifiers. Okay, so my name is Bianca. I'm going to perform an assessment on you today, if that's all right.
Yes.
Okay, awesome. Can you tell me who you are?
I am Howard Avery.
Perfect. Okay. Do you also know where you're at?
I'm at your house in White House, Tennessee.
Perfect. What are you doing here?
I'm here to assist you with an assessment.
Yes, I appreciate it. Okay, and what month and year is it?
It is the 6th of July, 2025.
Perfect. Okay, so he's alert and oriented to 4. So we're going to go ahead and start by actually asking, have you had any pain lately?
Yeah, some lower pain in my back.
Okay, and on a scale of 0 to 10, 10 being the worst, what would you say?
2 to 3.
2 to 3, okay. And when did it happen?
About 3 days ago.
Okay, and you said lower back, duration's been about 3 days. Can you describe the pain?
It's kind of like an intermittent sharp kind of pain.
Okay.
Almost like getting electrocuted but cut with a razor blade at the same time.
Got it. Is there anything that makes it worse?
Usually in like cold mornings.
Cold mornings, okay. Okay, is there anything that makes it better?
Hot shower.
Oh, okay. Have you sought any treatment for this?
No.
Okay, well you probably should.
Mhm.
All right, so we use the Old Cart mnemonic. We assessed his pain, now we're gonna move on to respiratory. So just by looking at him, I can see that his skin is pink. There's no gray or blue indicating any cyanosis. He's not in any respiratory distress, sitting upright, regular depth. His breathing is unlabored, no respiratory distress that I can see. Have you had any cough or cough with sputum lately?
Negative.
No? Okay. And it's not that time of the year right now. Okay, so I'm going to go ahead and listen to your lungs if that's okay.
That is okay.
Okay, perfect. Typically we wouldn't listen to lungs on top of the gown. However, to protect this man's decency, we will go as far as we can without taking his shirt off. Okay? Okay, and then just a regular rate for me, okay? And now I'm going to listen to the back of your lungs. You can shift a little bit for me. Thank you. Okay, lungs are cleared for auscultation and his respiratory rate is 16. All right. So now we're going to go ahead and do the cardiovascular portion. We're going to start with auscultating your heart sounds, okay?
Okay.
So it took me a little bit of a minute. So I'm going to go ahead and listen to the 5 valves and listen for a normal heart rate and rhythm. So I'll go ahead and start that. Okay, so here on the right side, second intercostal space, we're going to go ahead and listen to the aortic valve. Okay, and the pulmonic valve. And Erb's point. And the tricuspid. And then the mitral valve. Okay. We're going to do it with the bell. Heart rate is 90. Okay, and her normal S1, S2, no extra heart sounds. Rate is regular. Okay, so now I'm going to go ahead and palpate the carotids. Okay. Okay. So those are 2+, and then I'm going to listen with the bell of my stethoscope. Okay, I hear no thrill or bruit. Okay, and if you could go ahead and just lay 45 degrees. Okay, and then go ahead and turn your head for me. Okay, okay, and then the other way. Okay, yep. So there's no JVD noticed. Okay, his skin is also pink and warm, dry. Can I go ahead and see your, yep, perfect. His capillary refill is less than 3 seconds, and his skin turgor is elastic. He has even hair distribution, no presence of any lesions. Perfect, okay. And then now I'm also going to look at your feet. Oh, actually, before I start that, let me palpate your radial pulses. Beautiful, 2+. Okay. Now I'm gonna feel for his lower extremity pulses, so the dorsalis pedis and the tibial. Oh, beautiful. Okay, that's all good. Oh, nice pulse. Okay, perfect. And okay, so his pulses are 2+ in the lower extremities. Skin as well is warm, dry, and pink, and he has an even distribution of his hair. No lesions noted. Capillary refill is less than 3. Toenails are well groomed and they are normal shape. They are no clubbing is noted. And that is about it. I believe that oh, one more thing. Really quick. I've got to just perfect. And And there is no heaves or lifts noted as well in the cardiovascular section. I kind of skipped over that. But that is the end of video check off number 2. Thank you. Bye.